Anybody? So I have the pleasure of doing another introduction of Jared Make, who is going to be moderating our next session. Jared is a senior staff attorney at a fabulous organization, A Better Balance, which works to pass local, state, and federal progressive laws that improve work-life policies. And Jared has helped to draft and to pass dozens of state and local laws that bring people paid sick days and paid family leave and medical leave. He co-founded and leads A Better Balance's LGBTQ rights project to advocate for the rights of LGBTQ workers and to raise awareness about family diversity, which is pretty important in the whole paid leave advocacy space. He also has done work to enact workplace policies that cover a range of different kinds of caregiving relationships. He also directs A Better Balance's Defending Local Democracy project, where he works closely with cities to prevent and challenge preemption of local laws that guarantee paid leave and non-discrimination and other work family protections. These are very sinister laws that say that you can't pass any new laws. So thank goodness that someone's on the lookout for those. So Jared, thanks for moderating this session, and I will leave it to you.
Hi, everyone. Thanks, Barbara. I'm so excited to be here with all of you and my fellow panelists today to discuss the many opportunities that we have for achieving paid leave through policy and research. And so for reasons that we'll explore over the next hour and 10 minutes or so, this is an incredibly timely topic. So I'd like to thank IWPR, the Wellesley Centers for Women, and Spelman's Women's Research and Resource Center for devoting time in today's agenda to the issue of paid leave and inviting me here to moderate the discussion. So we're fortunate to have three paid leave research experts on today's panel, individuals whose research my organization, A Better Balance, relies on when making the case for these paid leave policies. And their full bios are in the conference materials and on your chairs, but I'd like to just briefly introduce them. So first, we have Jessica Milli, who is a study director at IWPR and oversees the organization's work on paid sick days. And she provides technical assistance to dozens of communities across the country. Next, we have Marci Ybarra, who is an assistant professor at the University of Chicago School of Social Service Administration. And she concentrates on poverty and inequality, social service delivery, work supports, and family well-being. And then finally, Sari Kerr is a senior research scientist and economist at the Wellesley Centers for Women, and her work focuses on the economics of labor markets, education, and families. So in a few minutes, Jessica, Marci, and Sari will each make a brief presentation, and then we'll have some discussion and, like the other panels, open it up to some questions. But before we dive in, I'd like to provide just a little bit of background to underscore the incredible momentum around paid leave issues that we've seen in recent years. So as you heard this morning, IWPR and the Wellesley Centers for Women held a similar policy research conference, similar to this one, in 2009. So as a result, I thought that 2009 provides a useful reference point to reflect on how much has changed in the paid leave movement in the 8 years since that last conference. So I'm going to do my best to do a 5-minute snapshot of the movement's success in the past 8 years. So I'll start with paid family leave. When the 2009 meeting was held, New Jersey had recently become the second state, joining California, to establish a paid family leave program providing partial wage replacement to workers when they need extended time off to welcome a new child and to bond with that child or to care for a seriously ill family member. Since then, we've won 3 more paid family leave laws in the country. Rhode Island passed the country's third in 2013. And just last year, two big wins, New York and Washington, D.C., became the fourth and fifth paid family leave laws that we have on the books in the U.S. And as you can probably imagine, with all of these recent wins, it's created a lot of momentum, and including the research that we're going to discuss showing that these laws work well, it's really led to a surge in the number of states that are working on paid family leave and introducing bills. And it's just important, I know we'll touch on this a little bit more, but the first four paid family leave laws that I mentioned were built on existing state temporary disability insurance systems that were already in place for a worker's own medical needs. And that includes pregnancy-related complications and recovery from childbirth. And with only 5 states that have temporary disability insurance systems, it's important to note that Washington, D.C.'s law represented a really important development in the movement because it created an entire program for both paid family and medical leave at the same time. And then at the same time, we've seen a trend in these laws and in the bills that are being introduced towards more robust paid family leave legislation, and we'll talk as well about some of those features. So during the same time period, we've seen a sharp increase in the number of states and localities who have stepped up as model employers themselves and are passing paid family leave policies for their own workforce. And then there have also been similar trends that we've seen with employers, particularly in certain sectors like the technology sector, who are also building stronger policies for their workers and leading by example. But as we'll learn today, government solutions are clearly still necessary when you look at who has access to paid family leave. So that's paid family leave. I want to move on quickly to paid sick time. So when the 2009 conference took place, there were 3 local paid sick time laws that had been passed. And by that I mean laws guaranteeing short-term paid time off for personal or family health needs. And voters in San Francisco and Milwaukee had approved paid sick time by ballot measure pretty overwhelmingly, while again here, Washington, D.C. had become the first legislative body to pass an ordinance guaranteeing paid sick time. So where do we stand 8 years later on this issue, paid sick time? So we've gone from 3 paid sick time laws to nearly 40 in the country. We're at 39 right now. That includes 7 states, 29 cities, 2 counties, and again, Washington, D.C., that now have paid sick time laws that either are or soon will be in effect. And as with paid family leave laws, there's been a trend towards more generous and comprehensive paid sick time laws. So although we have not yet passed a federal paid leave law, there's also been significant progress I want to touch quickly on at the national level. Since the last conference in 2009, President Obama proved to be a vocal champion on the issue of paid leave. And between 2014 and 2016, the Department of Labor's Women's Bureau made more than a dozen grants to states and localities for research and analysis regarding development and implementation of paid family leave programs. I should say paid family and medical leave programs. And in 2015, President Obama made a very passionate call for paid leave protections in his State of the Union address. We've also had strong bills that have been introduced in Congress to establish national standards on paid family and medical leave and paid sick time, known as the Family Act and the Healthy Families Act, respectively. And paid leave's also generated at the national level increasing bipartisan support. So just yesterday, some of you may have seen an AEI Brookings work group comprised of experts with a range of backgrounds and ideological perspectives, released a report with a title that I think speaks for itself, Paid Family and Medical Leave, an Issue Whose Time Has Come. And then again, in recent news, President Trump's proposed budget includes a plan to have states provide 6 weeks of paid parental leave through state unemployment insurance systems. And the plan, which notably does not cover leave to care for one's own serious health condition or a family member's serious illness, is a bit short on details at this point. But from what we've seen, it would leave a tremendous amount of latitude to states and potentially come at a cost to unemployment benefits. And the plan, of course, for parental leave is located within the context of a larger budget proposal with significant negative consequences for all American workers. And it would particularly harm women, children, and low-wage workers and families with respect to their core needs for medical care, food security, and child care. So to sum up this quick snapshot, the past 8 years have shown really enormous advances on paid leave, with increasing wins, proof that the laws are working well, greater media attention, and just a greater recognition at all levels of government that this is a critical need for workers and their loved ones. But at the same time, I would be remiss if I didn't mention, and Barbara touched on this, that all of the paid leave movement success has led to some strong pushback. So as more localities have led the way on issues like paid sick time, there's a growing threat of states blocking local pro-worker laws, as well as a significant range of progressive issues at the local level. As an example, 17 states have passed laws that preempt or block local laws on paid sick time without providing any guarantee at the state level to provide paid sick time. And earlier I mentioned that when the last conference was held in 2009, Milwaukee was one of the 3 paid sick time laws on the books in the US. But after the 2009 conference, and after supporters of the law won litigation challenging the Milwaukee paid sick time law, Governor Walker signed into law a bill that stopped Milwaukee's paid sick time law from going into effect and prevented any future paid sick time bills being passed at the local level in Wisconsin. So just to conclude, in addition to this threat of state preemption, we really do need to remain vigilant at the federal level to ensure that all of the state and local gains on paid leave remain on the books and are not preempted or threatened themselves through federal laws. And at a better balance, we have a Defending Local Democracy project that's working with a range of partners, including some of you in the room, and hopefully more of you soon, to resist any state or federal attempts to preempt paid leave. So to help us make the case both defensively and proactively for paid leave, it's essential that we continue developing the already strong research case for paid leave, which has been so critical to achieving all of these wins in the first place. So to dig in more to the research and analysis on paid leave, we're going to turn first to Jessica Milli from IWPR.
Great. Well, good afternoon, everybody. I'm glad so many of you were able to join us today. And as Jared kind of alluded to in his remarks, there are some pretty key differences between paid sick leave policies and paid family leave policies. So before I kind of dive into the weeds on our research, I just want to kind of reiterate what he was discussing before on what those differences are. And then we can dive into the actual research. So in terms of paid family leave, generally those policies cover leave for a variety of different reasons. It could be for the birth or adoption of a new child. It could be to care for a sick family member or to care for yourself if you have a serious health problem. Paid sick days also cover leave for cases where you yourself are ill or you need to care for a sick family member. But some of the key differences lie in how long the leaves are and how they're typically funded. So in terms of paid sick days, they're typically shorter term leave for instances where you get sick with the flu or you have a child that needs to stay at home and can't go to school. Paid family leave, on the other hand, is a little bit more longer term. So obviously you're not, hopefully not going to work right after you have a baby. You're going to need some extended time off from work before you return. Same thing for more serious health problems, like say you get a cancer diagnosis and you need time to get treatment and recover before returning back to work. And in terms of funding, paid sick days are usually structured as an employer mandate, so they are funded directly by employers in the form of your paycheck, your normal paycheck. Paid family leave programs, on the other hand, are typically structured as social insurance programs, either funded by employee contributions or employer contributions, or a mix of the two. So in that sense, the cost can be minimized a little bit. My work is particularly focused on paid sick days. So that's what I'm going to be focusing on, and my two co-panelists will be focusing a bit more on the paid family leave side of things. So just to start us off, I thought I would talk a little bit about why do we care about paid sick days? Why do we need a strong paid sick leave policy in our country? And we can think about the benefits of these policies in a number of different ways. We can think of benefits to employers, we can think of benefits to individual workers and their families, and we can think about broader benefits to societies as a whole. In terms of employer benefits, we have reduced contagion in the workplace. So if people are able to stay at home when they're sick without fear of losing a paycheck and putting their family's economic security at risk, they're going to be more likely to do that, to stay at home, to take care of themselves and get better before returning to work. And so when you don't have a coworker sitting next to you and you're in your cubicle coughing on you, you're probably not going to be spreading as much illness in the workplace, which is a positive benefit all around. Related to that is improved productivity and decreased workplace illnesses. So I'm sure most of us in this room have gone to work when you weren't feeling at 100%. And it's really tough to focus when you're not feeling well. And that shouldn't be a surprise. And so currently, employers are paying workers to come in and not be as productive as they could be. So with a paid sick days policy, workers are able to stay at home and take care of themselves and get better faster instead of trying to power through. And finally, we have decreased employee turnover. So paid sick leave and other workplace benefits are things that employees really value and really need in today's working economy. And when you feel valued at your workplace and your employer genuinely cares about your well-being, you're more likely to give your all for that employer. In terms of employee and family benefits, we've seen that workers who have paid sick days, they're able to use those sick days to go to the doctor, to seek preventive care services, to get cancer screenings, to get cholesterol checks and similar things of that nature. And they also get more timely treatment for illnesses that they do have. So if you can't take time off of work to get those health services, you're going to be waiting and waiting and waiting until it becomes a serious problem. And of course, that just exacerbates the problem. We've also done some research on the effect of paid sick days on emergency department usage. So it's kind of the same thing. If you aren't able to take time off of work when you're not feeling well, you're waiting until after work hours when pretty much the only solution that you have, the only option you have is to go to the emergency department to get treatment, which is way more costly. And so again, enabling workers to take time off during work hours without fear of losing pay will help reduce those costs. And just in general, you have increased employment and earning stability. So workers are able to take care of their own health needs and the health needs of their families without fear of, losing their job or losing pay and maybe not being able to pay rent for the month. Yet despite all of these benefits, millions of workers around the country still do not have access to paid sick days. And I know Jared mentioned in his opening remarks that we've had so much progress in the last 10 years or so. But even despite this, despite having 40 laws on the books, about 48 million people in the country, 48 million workers in the country do not have access to paid sick days. So we still have a really long way to go. So if we dive a little bit deeper into this figure and look at what the demographics are of that population that do not have access to paid sick days, we start seeing really stark inequalities existing in our workforce. We see gender inequality, for example. Even though men and women have similar access to paid sick days, women are disproportionately the ones who are staying at home when they have a sick child, for example. And so even though we have similar access to paid sick days, the lack of paid sick days impacts women more. We see racial inequality. Hispanic workers by far have the lowest access rates of any racial or ethnic group in the country, with only about half of Hispanic workers having access, compared with about 63% of white workers. We see income inequality. Lower paid workers have really low rates of access to paid sick days, and that's unfortunate because they're the ones that are the most worried about that trade-off between taking care of themselves and their family members or earning that paycheck. And I'm really glad that we had this conversation earlier about intersectionality, because all of these inequalities kind of pile up on one another and create huge problems. Hispanic workers, for example, are predominantly lower wage workers. They work in service industries that have lower wages. And all of these factors combine to create this situation where workers are worried about the economic security of their families. And in terms of what the impact has been for these places that have passed their own laws, we've seen some pretty promising trends. Before all of this progress had happened, employers were lining up the door, lining up in front of the door saying, this is going to be the worst thing ever. The sky is going to fall. It's going to cost so much money. But now that we've had experience with these laws and we've had a couple of years to get some data to look at what the impact has been, we've seen that that's by and large not been the case. Impact studies in Seattle and Washington and San Francisco and Connecticut have all shown that the impact on employer costs has been very minimal. The laws have been easy to implement. Employees do not abuse their paid sick days allotments. And by and large, paid sick days are not a job killer. And in fact, employment growth has actually been stronger in locations that have passed their own laws than in surrounding areas that do not have their own laws. So we've seen these positive impacts. And after employers have had the experience of, implementing these laws and have seen that the sky has not fallen, we've also seen that employers are becoming more supportive of these laws.
Great. Thanks, Jessica. So I do want to also acknowledge that as the Better Balance is working with cities and states around the country on a lot of the legal work, that I have Jessica and IWPR on speed dial, and just how important this research case is, and being able to equip advocates on the ground with the numbers and what Jessica just talked about is invaluable. So did want to make sure to acknowledge that. So we're going to turn next to Marci to talk a bit and segue into paid family leave and some of the landscape around the country and some of your other related research there.
Great, thanks, Jared. Oh, let me. Okay. So first I want to start by thanking IWPR, Wellesley, and Spelman for convening the conference and inviting me. It's a great opportunity to share my work. I'm going to start by talking a little bit about paid family leave, and I'm going to try and not repeat what's already been said. I'm going to focus probably a little bit more on policy variation, because I think a lot of folks in the U.S. hear paid family leave, and there's an assumption that these programs look really similar, and to some extent they do, but they can be very different in really important ways. And then I'm going to transition to talking about several national policy proposals that are on the table. One was released yesterday, and so I was scrambling to read it. Hopefully I thoroughly vetted it. And then lastly, I'm going to focus on my own work, on paid family leave and the intersection of the safety net. And so when I say safety net, I'm referring to means-tested programs in the U.S. that predominantly serve low-income families. And the reason I focus on the intersection of paid family leave and the safety net is because a lot of paid family leave programs have what I would consider, from a low-wage worker's point of view, relatively strict work requirements. And so that means that some low-wage workers, and I would argue perhaps the most economically vulnerable are those with young children, are going to be left out of paid family leave. Okay? So in that instance, we would hope, if you're interested in care about family and children's development, we would hope that the safety net might make up for the difference. Or an alternative to that would be, if you're in a state that provides paid family leave, but the wage replacement is relatively low, and you're a single mom who makes $10,000 a year, then paid family leave probably still isn't going to be enough for you. So even in that instance, if it's a lower wage worker who's receiving paid family leave, then we would want to see the safety net buffer in addition to paid family leave's buffering for lower wage workers and families. And I'm going to do all that in 10 minutes, so buckle up. So as many of you know, there's currently 3 implemented paid family leave programs. Of course, the longest serving being in California in 2004. A funny story how I got interested in this. My sister had my niece in August of 2004, so was one of the very first recipients of paid family leave. And I'm interested, as Jared noted, in social service delivery. So I'm interested in how families become familiar with programs. And so I asked my sister, how did you even know about paid family leave? And she said, well, I didn't. My employer enrolled me. Right, so had her employer not enrolled her a month out of the program, she wouldn't have known, and she probably wouldn't. It's hard to make a case that she would have taken up the program. So I was like, oh, I wonder how that works for lower wage women who don't have the supports my sister had, who was very fortunate to have a lot of supports. So anyhow, those 3 programs are in place, and there's variation in sense that, like Rhode Island provides 4 weeks, whereas the other range of it would be California provides 6. But that's a little bit misleading because these states also have temporary disability insurance programs, which we're not going to talk in a lot about today, but I wanted to acknowledge in most the existing paid family leave program states, most folks are able to combine temporary disability insurance leave with paid family leave. So for most folks, it's going to look more like 10 to 12 weeks of some kind of paid leave for moms, because to claim temporary disability insurance, you have to be recovering from childbirth. So it's exclusively for moms. So as far as the research on existing programs, there were a lot of concerns, similar to sick days, that the sky was going to fall, especially for businesses, that it was going to be cost prohibitive and very difficult for businesses to negotiate and manage. And most of the work we have on that is from California. And I think the conclusion is that the effects on business have either been marginal or neutral. And that's encouraging for other states that are considering a program like paid family leave. There was also questions about what would this mean for work, especially for women. As I noted before, and Jared's noted, paid family leave covers a host of different caretaking responsibilities. My work focuses exclusively in the period surrounding a birth. So I focus on women's employment that are in the lower wage of the economic spectrum. So a lot of the questions were, what would women's work look like, particularly because California's paid family leave program did not include job protection. Okay, so if we buffered women around the time of a birth, what would that mean for work? Should we expect labor force attachment to look similar to what it might look like for folks who would get Family and Medical Leave Act where there is job protection? And it turns out the results have been fairly robust and positive, that post-implementation, women across all education levels are more likely to take leave. They're more likely to take longer leave, and by longer leave I mean on average several weeks, and there's stronger labor force attachment. meaning that women are more likely now, post-paid family leave in California, to actually return to work and return to their same employer. And there's a couple of caveats on that, which would be for lower wage women, there's been some evidence that lower wage women, Black and Latino women in particular, are less likely to know about or enroll in paid family leave in California, even when they're eligible. So there's absolutely concerns on the take-up side that it might not be reaching some of the most vulnerable families. In addition to the paid family leave programs in place, there's also two that are slated to begin. The first one that I wanted to mention was New York. It's slated to begin in 2018. Comparatively speaking, it's much more generous than the existing paid family leave programs. It'll start at 8 weeks, but by 2021, leave time will be 12 weeks, which is very encouraging. There's also Washington, D.C.'s upcoming paid family leave program, slated to begin in 2020. I find this one particularly exciting because my biggest pushback on paid family leave is that the wage replacement rates should be progressive, meaning that lower income families should get the highest wage replacement rates that are equivalent to 90 to 100%. Because it's not a buffer, it can actually be a lifeline for some of these families. And so Washington, D.C.'s program is slated to have a 90% wage replacement. And if you're a higher wage earner, it's going to be more. It gets a little complicated. And they've taken a unique approach to time off from work. So to care for an infant or new child, it's 8 weeks. To care for a family member, it's 6 weeks, and then for your own illness, it's 2 weeks of time off. So it'll be interesting to see, as someone who's interested in implementation and think it can really matter, how that rolls out in terms of monitoring that by the state. So overall, I think it's fair to say, given the New York and D.C. proposals, that the trajectory of paid family leave in the existing states is trending towards the more generous. And we see this reflected in some of the national policy proposals going on. I'm just going to briefly mention these. There's the Family Act, which I'm assuming lots of folks are familiar with. This is the DeLauro and Gillibrand proposal, and it's 12 weeks for a national program at 66% wage replacement in the U.S. It offers a form of job protection, but lots of folks aren't calling it traditional job protection because it's a little bit different, and I won't get into the weeds on that because of time, but it's really encouraging, and they're proposing it as a mix of employer and employee tax to pay for it, where a lot of state paid family leave programs are actually employee only. So I'd also say that's encouraging. And they're also doing something unique in that they're giving specific time off for caregiving for military families to deal with when a family member becomes deployed, which a lot of paid family leave states at least don't signify this in their laws. The second national proposal in play is the current administration's proposal. Comparatively speaking, it's less generous. It's parental leave, it's not family leave, because it only applies to mothers and fathers following a birth. As Jared mentioned, or maybe it was Jessica, the plans are pretty murky, but it is only 6 weeks. And it's going to be based on, it's proposed to be based, thank you, on the unemployment insurance system. And so the concerns about that are that unemployment insurance wage replacement rates are lower than current paid family leave replacement rates, even the most generous ones. So they hover around 50% and even lower in some states. So the concern is that the states will follow the same wage replacement rates as their unemployment insurance benefits. And then finally, there's a new report released by the American Enterprise Institute in Brookings, where they proposed also a parental leave program, 8 weeks long, at a 70% wage replacement rate. And so this, I've got 2 minutes left, and Dana told me she did not come to play with the time. So I'm going to make sure I get to my research. So she's clapping. So I think that I think it was an incredibly unique idea. AEI folks and Brookings folks came together, experts across, a bipartisan spectrum, and for a compromise bill, one that might actually have legs, so to speak, in a Democratic and Republican context, and came away with 8 weeks at 70% wage replacement, which is encouraging, but they also recommended that we base the work requirement on the Family Medical and Leave Act, which, if you're familiar with the Family and Medical Leave Act, it means that a worker would have to work 1,250 hours for the duration of a year to qualify. And so as someone who focuses on low-wage women, particularly those who oftentimes have to rely on the safety net, I know, and lots of you know, FMLA currently only covers about 60% of workers, largely due to those requirements, and it's disproportionately uncovered workers that are low income and less educated. All right, and oftentimes single women women with children. And so part of my work tries to take into consideration is, yes, this is about women's work and women's equity. It's also about maternal and child health and children's development in the short and longer term. And so economic deprivation around a birth, we know is increasingly being linked to children's brain development as infants as early as 6 weeks old. So my research takes into account what would it look like if we consider paid family leave as well as a safety net. So what women would get. And so on both sides of the political spectrum, folks are really worried about, well, if programs are too generous, will this disincentivize work? Right? This is a big question around work in general, especially when you take the safety net and paid family leave together. So my colleague Heather Hill and I, who's from the University of Washington, did a study where we looked at a state having paid family leave, or TDI, it was both actually, because they're all the same states, and then the generosity of the safety net. So how much states spend on programs like child care subsidies and TANF, and Medicaid and SNAP in the Women's and Children's program, because we wanted to be able to answer the question, do more generous safety net provisions lead to more women quitting a job around a birth? Because if it did, you could make the argument that this would exacerbate existing labor market inequalities in skill depreciation and wages over time. And so we didn't find a relationship between generosity of the safety net and women quitting a job around a birth. And part of what we think it is that our safety net's relatively a patchwork system. Right? So if you think about programs that would buffer around the time of the birth, they would primarily be our cash welfare system, which might act as a means-tested paid family leave for women who don't qualify for paid family leave, right? And child care subsidies, which would offset the cost of care and allow lower-wage women to work. Well, both of those programs have limited reach. Only 24 out of 100 families currently eligible families receive TANF, and about 20% of eligible families receive child care subsidies. So in closing, I wanted to say, because Dana told me to say in closing when you're almost done. So in closing, what I wanted to say and end it with is, with paid family leave, I think having a paid family leave program that is really contingent around strict work requirements is fine in the context of a really strong and generous social safety net, in which lower-income moms who are left out of paid family leave provisions have a social safety net that they and their children can turn to if they're not included in paid family leave provisions. We currently don't have that. And so this is in the context of the current administration proposing even deeper cuts to some of these safety net programs. And so what I wanted to leave you with is that the fight for paid family leave, that conversation, from my perspective and my focus on lower wage moms, is a conversation that cannot happen without also advocating for and having a discussion about the necessity for a robust safety net, especially for low wage women who might be left out of paid family leave provisions. Thank you.
Thanks so much, Marci. So we're going to turn now to Sari to build on some of the case for paid family leave and also bring in some of the international comparisons and what we can learn there.
Thank you. I'll try to not get us late after all the previous speakers have been so timely. So I'll focus fairly narrowly on paid parental leave. And what I mean by that is just that people have paid time off for being a parent after the birth of newborn or after an adoption. And this includes some job protection and also some percentage compensation as a percentage of your salary. And for this definition, it's not really critical who pays for this, whether this comes from employer contributions or employee contributions or whatever it comes from. And in other countries, I think if we were anywhere else, it would be perfectly sufficient to end here. It would be kind of like anyone would understand what I mean by this. But in the US, it does become a little more tricky, as I found when I had my first child here. I was told that my employer pays for 12 weeks of paid parental leave, and I was assuming that it means that they pay for 12 weeks of leave, but that's not what it meant. It meant that I need to take my vacation time, my sick time, my personal days, and then at the end they might pay a little bit, or there might be some contribution from short-term disability into this, and it all became kind of a big hodgepodge of how this money is coming together. And I didn't actually have an idea that this is what it was going to be like, and that got me interested in this topic. And this is actually important because if we try to use any data to figure threw out a simple question as to, like, for example, what percentage of new moms and dads in the US have some paid parental leave coverage, it becomes more complicated than you would think that it should become. And the data doesn't actually help us here, so we have various data sources that we can use to try to tease this out in the US. The Bureau of Labor Statistics National Compensation Survey is a popular one that people use. It asks employers, but it gives you a pretty low coverage rate because it excludes some of these components that I just discussed. Some people use the American Time Use Survey that asks people about their weekly time use. That gives you a totally different estimate. Then we have the National Longitudinal Surveys that I sometimes use, and I'll mention briefly in my own research. And then the Current Population Survey and the SIP, again, are sort of more rough estimates can be retrieved from those as well. But none of these are really great because so right now, and definitely going forward, as we see more paid family leaves coming at the state level, it would be really nice to have some much better data. And again, so I like big data. I would like a very large survey of households, ideally, where we follow individuals over time, where we would know where they work, whether their firm offers paid leave, what is the availability, what are the restrictions at the firm level. So for example, does the firm require a specific tenure or full-time versus part-time employees, like how are people covered? What is the length and level of compensation during this leave? What is the source of the money? Is it coming from vacation, sick time, or is it really, like, how are firms putting these paid leaves together that they actually do offer? And then how do people use leaves? And then the longitudinal follow-up would, of course, be interesting because I would love to know what happens to the firm and what happens to the worker as well as maybe the child over time after this paid leave has ended. So the previous speakers have already mentioned many of the benefits of paid family leave. So obviously the health of the mom and child, the productivity of the parents, positive career effects for mostly women. We know that the job retention is increased, quitting and exiting from the labor force is reduced, the earnings, long-run earnings of women increase, which in the long run will reduce the gender pay gap, might actually improve the poverty rates to some extent. But more importantly, even for the national economy, we would just use human capital more efficiently. If we retain skilled individuals who are experienced in the workforce, that'll increase the tax base, tax payments, and eventually the GDP as well. There's a lot of theory as to why it might be useful to have a more universal paid leave system rather than having firms decide whether they offer paid leave or not. It is simply sort of this idea of adverse selection. If only some firms offer family-friendly benefits, then workers who really are enjoying those types of benefits will adversely select into those firms, and it can get quite costly for the firms that are offering them. Instead, if all firms provide these leaves, then the average cost for the firm is going to be reduced greatly. So that's one point. I think the other point is also people are arguing about this unfairness of firms in different sectors. So we know that women and men differentially work in different sectors, and so the female-heavy sectors, the firms in those sectors might suffer in particular if their paid family leave is required by firms. There's different options. You could obviously make paid family leaves more equal in terms of men and women, so require a more 50-50 division of leave usage, or you could use what many other countries use, of social insurance or tax type systems to finance those that would even out the burden for the firms. So my own firm, sort of work that I've done is I've done some work on paid leaves, but also unpaid leaves. And using the National Longitudinal Survey of Youth, I want to point out a few important things that came out in my own research. And so much like it was the case with the paid time off for your own illness, it turns out to be the case that there's these vast differences across families of low-income families and high-income families in terms of their access to both unpaid as well as paid family leave. And so low-income mothers are much less likely to have any kind of leave coverage, any kind of job protection under the FMLA as well as under the sort of firm-provided paid leaves that exist. And even though the availability of paid leave as well as unpaid leave has gone up over time, the difference between low-income and high-income families has not been reducing. So that's one of the key issues to consider. And so when we think about any policy proposals, it would be very important to understand that these criteria like job tenure, you need to have worked for firm for at least a year, or you need to work at least 1,200 hours a year, are really going to disproportionately hurt the low-income families and benefit the high-income families. So that's very important. And the other thing I think that is important to note is the affordability. And so even if paid leave is offered, if the replacement rate of income is very low, that doesn't really help the low-income families. So I promised to talk a little bit about international comparisons. And the nice thing about when we're a country, which is sort of the last country on earth that doesn't have a paid leave, is that we have a lot of places we can look for examples. And so try to pick and choose what might be our favorite systems to learn from. And so your usual suspects in the Good Guys Club include the Scandinavian countries, Finland, where I come from, Sweden, Denmark, Norway, all tend to have a paid leave that starts before the child is born, have high income replacement rates, somewhere in the range of 80 to 100%, at least for some part of the leave, and then sometimes going up to a full year. They tend to have a specific time off for fathers, also paid, and then sort of a low pay or flat rate shared leave that is available for even longer than that. So in Finland, I think up to the point where the child is 3 years old. So that may seem like we're never going to get there, so there's nothing much that we can learn from the Scandinavian countries. Perhaps that's too optimistic. If we look at something that's maybe closer to home, then we can look at Canada, where there's also recent developments in terms of the paid parental leave. So currently they have a 15-week paid leave that is for the mother. If you're a high-income mother, then 55% of pay, and for low-income mothers, 80% of pay. So again, sort of having a differential pay rate for low versus high-income parents might be important, and then a shared component of the leave, but no paternity leave as such. And then again, I could go on and on about this. Germany is another interesting case. It's a fairly recent arrival into the Good Guys Club, but I'm going to skip that for the interest of time. And so what do we learn from those international comparisons if we really want to make a robust system that might work also in the US? I think that, so the two key goals are job protection and financial support. And we need about 5 or maybe even 6 pieces that are important. So first of all, we need a pretty generous replacement of income. Most families do rely on their monthly paycheck. They really need a generous replacement of income. We want universal coverage with as few eligibility restrictions as possible. So again, don't want to make it too restrictive for families to qualify. We probably want some non-transferable quotas for both parents, not just one parent taking the whole leave, but then allow some flexible scheduling after that. So allowing some sharing of the remaining quota, and also some time, like how do you want to time this leave, even though it may be more complicated for the employers when parents try to take 6 weeks here and 6 weeks there rather than everything in one lump. And sort of important from the firm's point of view is this financial structuring of it. So we don't want firms to have to self-insure them, especially if we have issues related to the adverse selection. We want a risk pooling among as many firms as possible. So something like the California system, for example, and so that's important to make it more sustainable for firms. And then if we actually really want to realize the benefits, both in terms of the career of the individuals as well as for the firms to get their skilled and their experienced workers back, then we do need to have a plan for what happens when the young children actually go back to, so parents of young children go back to work, because if we then don't have anywhere to go, then the parents are still going to have to quit because there's no affordable daycare option. So it's sort of hard to think about this parental leave in isolation from any of the other policy components. And Germany, for example, like I mentioned, the recent arrival in the Good Guys Club is a good example. It has always had this one-earner model, and so they did give a very generous, 1 year parental leave, but then they didn't have anywhere for 1-year-olds to go when the mom is supposedly returning back to work, and it's particularly problematic in some more rural areas and outside of large cities where that kind of thing is not available. So in conclusion, we've been well trained. there is a lot to learn from other countries' systems and sort of best case scenarios and best practices that can be put place into the U.S. But in order for us to make a better case, we do need more data. It's in order to, if we become, I mean, we have some nice stuff from California, but we would also like to be able to study more broadly and make sure that things can be verified elsewhere as well. Thank you.
Thanks, Sari. So I think before we turn to your questions, just a few follow-up questions and threads to pull. Well, so Marci mentioned the Federal Family and Medical Leave Act and how it leaves out so many workers, a big gap in the law. It does, and it's of course unpaid, which is a major shortcoming as well. It does include, though, care for a seriously ill family member, albeit a narrow family definition. And then of the about 40 paid sick time laws, they all include care for a family member's health condition, as do the 5 state paid family leave programs, as well as the Family Act that's been introduced in Congress. So, you know, the administration's budget, though, as we touched on, only includes parental leave for new parents. So I was wondering, Jessica, if you could touch on any research that IWPR has produced or gathered about both the value of allowing workers to care for a family member, particularly given our aging population, and the relative cost to a paid family leave program that allows workers to care for a range of loved ones.
Sure. So I think one of the things that came as a surprise to me when I first started working on these issues was just how small a part of overall leaves taken under FMLA are actually parental leaves. Currently, our estimates, I believe, say about 16% of all leaves taken in a given year are for parental leaves. The vast majority are actually for own health and family care leaves. And so when you have a proposal that's only covering such a small share of the overall leaves that are taken in a given year, you're leaving a bunch of people out, and you're really compromising the economic security of millions of families because of that. We've been doing a lot of really exciting work recently, thanks to some funding from DOL 2 years ago, to update a simulation model that will help us estimate the cost of various proposals that are happening at the state level and even at the national level. And the simulation model allows us to take a look at current leave-taking behaviors in our areas of interest and say what would happen if we have a policy proposal like the Family Act be implemented. What would the costs be? What would the benefits be? And we're finding overall that, again, contrary to this belief that the sky is going to fall and it's going to be incredibly costly, the costs are actually pretty reasonable. And one of our more recent research briefs that we've put out evaluated a variety of national family leave proposals, including the Family Act, including what would happen if we implemented California's law nationally, or the recent revisions that have happened to California's law. And we found that the cost of providing these paid family leave programs are only about, I think they range from 0.45% to, it looks like 0.63% of annual payrolls. So it's a pretty reasonably priced plan for, you know, all of the benefits that we've been talking about.
Great. And I think, you know, staying with this timely news about the administration's budget as well, you know, Marci, and you touched on this, but given your research on the well-being of low-income families, you know, how should we consider the proposed federal budget that both advances parental leave, but also at the same time includes deep cuts to food stamps, Medicaid, TANF, and other very important safety net programs?
Thank you. I think there's a few ways to think about it. I think the first way that I think about it, because I focus on lower income women with kids, is that even without those cuts, we're concerned about access to the safety net by lower wage women, who, especially those who have young children. So if you layer on top of that a gutting of some of these programs, particularly Medicaid, which it's not just about women and children as families, but it's also about women's preventative health, right? And so if you take that away, in theory, unfortunately, what you could see are more unintended pregnancies, right? Because healthcare expansion, Medicaid expansion should have exposed lower income women to healthcare prior to getting pregnant, right? So it should have been preventative in that nature. I'm guessing like lots of folks are working on research on Medicaid expansion and what it means for women's health. But the primary beneficiaries of Medicaid, or the overwhelming beneficiaries of Medicaid, are the disabled, the elderly, and children. And so if I think about a safety net program that we've made unbelievable gains in since the ACA, it would be Medicaid expansion, and there's lots of encouraging research to support that. Food stamps is an interesting case to consider in light of paid family leave. There's evidence from California and New Jersey that post-paid family leave implementation, food stamp participation actually drops among lower income women. So there is some concern, my own work discusses this, that if you have lower income women who are substituting paid family leave for safety net programs, on the one hand, we think that's a good thing because safety net programs can be stigmatizing. Maybe we think it's good if it works as a perfect substitute, meaning that the resources look similar and so they're not missing out on anything. I think what we don't know is when there's a drop in food stamps when a paid family leave program is implemented, is it actually a perfect substitute, right? Are families actually receiving similar resources? And if they're not, then it's a case of how should we think about that? And so my concern with a cut to food stamps is for all lower income families, but particularly around the time of a birth for lower income women. So I think of, like, as I mentioned in my talk, if we're going to have a paid family leave program that's premised on a fairly strict work requirement, then I think cutting the safety net makes no sense at all if we are concerned about good outcomes for maternal and child health and also mom's work.
Thanks. And then I think, sticking with the timeliness of some of these questions, we mentioned the AEI Brookings report that came out yesterday. And as I was looking through it, it did say that most of its work group members favored a social insurance approach funded by employee payroll contributions. So, Sari, I was wondering, based on the international models that you touched on, and as well as the state programs in the U.S., if you could discuss some of these different funding models and approaches, like who pays, how it's structured, and how we should think about it.
Yes, so there's a lot of variation across countries in terms of who pays and how it is financed, and so a fairly rare model is to use pure employer liability. You can mandate employers to give leave and also mandate that they will have to pay for it. This is especially with any longer durations, you don't see this a lot. There's a few countries in the Caribbean, some African countries that have a strict employer liability. And then there's also sort of the opposite end of that, which is this just sheer financing with taxes and public budgets, where you have a social security or social insurance type program that covers the whole thing. In Sweden, it is actually the employers who pay the taxes, that the employers are paying a monthly tax for each employee, and then that finances everything. You could also go to this employee payroll deduction model, like we have with the unemployment insurance program. So those would be the opposite end. And then actually the most common system is sort of a mix of these two, so hybrid, where most of the money comes from a social security, social insurance that is tax funded, and then there's going to be an employer liability that tops it up. And for example, in Denmark, what they do is there's collective bargaining agreements that decide how much the employer puts on top of what the sort of social security or social insurance covers already. And so I'm not an expert in this, but there's definitely lots of models to look at.
Great. So we'd love to turn to you. I mean, fortunately, we do have a lot of research and models and just put a lot of that out there. So, are eager for any questions that you have. Over here.
Hi. Is this on? Okay, great. Thank you so much for coming and speaking today. My name is Isha. I work with Futures Without Violence. And one of the aspects that I think hasn't been highlighted yet in the panel, but I'd like to get your expertise and feedback on, is this idea of sick and safe leave. Oftentimes, employees will need leave if they're in a situation of domestic violence or sexual assault or stalking to go get a restraining order or go to court. And that's not a leave that's offered, at least in a paid version, by employers. So just hearing about your thoughts on that or what the trends are would be great. Thanks.
Sure, I'll take a stab at that to begin with. So I think a pretty good share of the laws, and correct me if I'm wrong, Jared, you're probably a little bit more up on the variations than I am, but a good portion of the paid sick days laws that are being passed at the state and local level are recognizing this need for safe time, and a large number of them do include provisions that allow workers to take paid time off to deal with the aftermath of domestic violence incidences. And there's a fair amount of research out there now on just what the economic impact is on employment and wages of domestic violence. I believe the CDC released a report a couple of years ago that estimated the wages lost in a given year due to domestic violence, and unfortunately I can't remember the statistic off the top of my head, but it's an astounding amount. And the fact that many of these state and local policies are starting to recognize this and take that into account is very encouraging.
Yeah, thank you. It's such an important feature, and there has been a clear trend towards covering safe time. I would say almost all of the campaigns do, unless there is any sort of legal issue with a locality doing it, if the state already provides some protections. But the other piece that I would mention is that's why we're also fighting for broader family definitions in all of these laws, particularly in the context of safe time. You know, often who you turn to if you're fleeing a home or need to go to a court appearance, if somebody needs time off to help you, isn't a parent, child, spouse. You know, so that as we think about how we're defining families in these laws, it's another example of why it's so important. But thank you, that's a great question. Yeah, right here. In the blue.
Hi, good afternoon. I think one of the pieces that I'm not hearing a lot in the discussions, but someone mentioned it this morning when they talked about building power, is the role of unions and trade unions. And I think for me, it's important to talk about in all of the panels that we've heard about today, because unions are looking globally at the issue of gender-based violence in the world of work. I work in Latin America, and where we see that, you know, farm workers are earning things like lactation time, that comes through collective bargaining agreements. And I think in the US, it's not like we're looking in any kind of favorable, you know, legislative environment. If we're looking at things like national right to work laws that are going to make unions even weaker, I think that's going to hurt a lot of women, because unions are the places where we're narrowing the pay gap, where the pay gap doesn't exist, where we have maternity leave and all these other benefits that we stand to lose as well.
Mm-hmm. Yeah. Any thoughts based on that? I mean, certainly agree. And unions have been incredible partners in the fight for paid leave, both, again, leading by example, but also joining the campaigns and really being a critical partner, as well as recognizing the fact that it lifts everybody up. You know, when you don't have to bargain over a new minimum, a new floor, it, you know, creates more power to fight for other pro-worker benefits. Other questions? We have a couple minutes. Yeah, we're here in the white.
Thank you, guys. I'm wondering if any of these benefits will extend to small business owners or independent consultants.
So in terms of paid sick leave policies, at least, there's quite a variation in the state and localities that are passing the laws. Some of them cover all employers regardless of business size. Some of them do have carve-outs for smaller businesses, sometimes businesses employing under 5 workers, sometimes under 50 in the case of Connecticut. So there's a wide variety of exemptions there. And it's unfortunate, I think, too, because if you look at the data on the distribution of workers by firm size, you know, you think exempting small businesses isn't going to exempt a lot of people because by definition they employ few people, but a large percentage of the businesses in the country are small businesses. And so when you start talking about exemptions for those small businesses, you start losing coverage for, you know, at times millions of workers. So it's an important thing to consider. And as I briefly mentioned in my remarks, we've been finding that even though there's been this concern about how costly this is going to be for businesses, particularly small businesses, we've been finding in the places that have implemented them that this really hasn't been the case.
Yeah, and I would just add in the context of paid family leave, the voice of small business has been huge. In New York, where A Better Balance is based, and we help to lead the paid family leave campaign there. It's employee funded, and small business really was a champion of saying, no, this needs to cover us. We want to do the right thing. It might be hard to pay 12 weeks of paid family leave, but we want to be competitive. So having a social insurance type system where employees are contributing made a lot of sense. So we really are fighting to cover workers at all size businesses, and making sure that those voices are represented, as well as opt-in models and paid family leave for contractors or others who maybe aren't covered. So we do have language and models for that as well.
I would maybe add on to that just a little bit too, and reiterate the fact that this is something that employers are already dealing with. They have people, employees giving birth every year, and they still have to come up with a way of dealing with this. And for employers who are providing paid leave for their workers, you know, that's great for them, but these programs, these social insurance programs, actually help them do that while, you know, oftentimes lowering the cost because their employees are contributing to it. And we're kind of cost sharing across the economy rather than having the entire onus of the payment for these leaves on the employers.
That's great. So I think we're about at time. You know, Sari, Marci, Jessica, any other final thoughts before we conclude and turn it over to the next panel? Or anything where research could be really helpful going forward?
One area in closing I think we didn't talk much about, and I think it's really important, is across states how much the safety net varies, right? Oh, thank you. Just the safety net across states varies pretty dramatically. So in thinking about programs, especially those that are block granted, so child care subsidies and TANF, and that's what's being proposed for Medicaid, right? So if you think about what's happened with TANF, it might be a harbinger for what could happen with Medicaid if that occurs. So the point of that being that women who live in Mississippi, right, have access to a relatively different and I would say meager safety net compared to women in California. And so when we do analyses of not only paid family leave, but other programs that might also buffer lower income families, it's important to take into account variation across states and the generosity of states, because that looks really, really different in the U.S.
Great. So, you know, I want to give a huge thanks to the panelists, to Sari, Marci, and Jessica for sharing their expertise. Even prepping for the panel, it was so great just learning more about your research, because it really is so important, and I think reflects, as we continue to have momentum around paid leave, you know, how much we can learn about the best ways to provide paid leave through research and policy analysis. So thank you. I think, are we going straight through? Okay, so we're going to take a 3-minute break, but I did want to just introduce that our next panel is going to be moderated by Alicia Garza, who is the Special Projects Director of the National Domestic Workers Alliance, and also co-creator of the Black Lives Matter movement. So thrilled to have her here. And the next panel will discuss findings from a really exciting new report from IWPR and the National Domestic Workers Alliance. So excited about that, and maybe now it's a 2-minute break. 2.5 minutes.